Hi, I'm Dr. Eric Lewis, and today I'd like to talk to you about carpal tunnel syndrome. Carpal tunnel syndrome is one of the most common causes of numbness and tingling in the hand. This condition is caused by pressure on a nerve in your wrist called the median nerve. This nerve provides feeling to the thumb, index, middle, and half of the ring finger. This nerve also sends a signal to the large muscles of the thumb. The median nerve enters the wrist under a structure called the transverse carpal ligament. This ligament serves as a roof of the carpal tunnel and can place pressure on the nerve. This pressure can cause the numbness and tingling mentioned above. It can cause pain that radiates into the hand or upwards towards the elbow. It can cause weakness of the hand and make it difficult to handle small objects. Patients will frequently complain of symptoms that wake them in the middle of the night. Diagnosis of carpal tunnel syndrome requires a history and physical exam to determine if the median nerve shows any signs of irritation. A test to evaluate how well the nerve functions and if the muscles are healthy may also be performed. Treatment may consist of use of a brace, steroid injection, or surgery depending on the results of these evaluations. Surgical treatment is designed to cut the transverse carpal ligament and decrease the pressure inside the carpal tunnel. There are two general surgical approaches: the traditional open carpal tunnel release or a minimally invasive approach called the endoscopic carpal tunnel release. The two procedures both achieve the result of cutting the transverse carpal ligament, but the endoscopic carpal tunnel release is typically done through a smaller incision, typically less than 1 centimeter, and does not require an incision to be placed in the palm. Medical studies have shown the potential for quicker recovery with the endoscopic carpal tunnel release as compared with the traditional open carpal tunnel. I have successfully performed well over 1,000 endoscopic carpal tunnel releases. This procedure is done under local sedation, which allows for a quicker recovery after the surgery. The procedure typically takes less than 10 minutes. After surgery, you will have a Band-Aid over the small incision and will be allowed to use your hand as you see fit, provided there is no significant pain during the activity. Recovery is dependent upon the severity of your carpal tunnel, but most patients experience a significant improvement in their symptoms 1 to 2 days after surgery. I invite you to call and make an appointment to see if endoscopic carpal tunnel release is the answer to your tingling and painful hands. You could be less than 10 minutes away from your best night of sleep and a return to activities you thought you could no longer enjoy.